Hello, everyone. My name is Anika Gianforte, and welcome to our coronavirus booster for the week of May 10th, 2021. We're going to kick things off by covering where we are at as far as cases, hospitalizations, and deaths go as far as COVID-19 is concerned. Cases are down about 30% when we look at our 14-day change. Hospitalizations are down 13%, and deaths are down 6%. And this is following a slight bump from a few weeks ago. So it's good to see this downward trend continuing to happen. But that being said, we do need to remain vigilant because we have not yet reached herd immunity. If we look at this chart from the CDC, we can see a breakdown of how many folks have been vaccinated in different categories. So as far as our total population is concerned, about 46% of the total population has had at least one dose of the vaccination, and about 34% are fully vaccinated. This chart breaks things down further as far as the percentage of the population 18 years of age and older is concerned, and the percent of the population 65 years of age or older is concerned. So when we look at our 18 years of age and up, about 44% of that population is vaccinated, whereas the percent of the population over 65, about 71% of that population is vaccinated. So it's estimated that about 70 to 90% of the total population, including adults and children, need to acquire resistance to the coronavirus to reach herd immunity. And when transmission of the virus is substantially slows, that's when we will be able to reach herd immunity because enough people have been protected. So providers right now are administering about 2.02 million doses per day on average of the vaccine. And that's about a 40% decrease from our peak of 3.38 million reported on April 13th. So we're seeing that many people still are getting vaccinated, but at the same time, a lot of the folks who really wanted that vaccine have already received the vaccine. So it's going to be a little bit of an uphill climb to get the remainder of the population vaccinated because the people who really wanted it have likely achieved getting that vaccine already. So as far as herd immunity goes, for now, the vaccines are not approved for children 15 and younger. But Pfizer did recently request that the FDA expand the emergency use authorization for their vaccine to permit the use of it in children 12 and older. So if that happens, young adolescents could potentially begin getting vaccinated before school starts in the fall of 2021. So we'll have to stay tuned to see what happens with that. As far as vaccinations go in the workplace, we still should continue to encourage vaccinations. And again, because those vaccines have been more available to people, the folks who really wanted it likely have started to get the vaccine or have already been fully vaccinated. So this will become more challenging, but it's really important as far as how we end this pandemic. And there are changing dynamics on how to respond to COVID-19 positives because we do have a partially vaccinated population. So one thing that you in the workplace should consider is what to do when an employee tests positive and you have a partially vaccinated workforce. Now, some of this you can rely on your local health department guidance for, but it is important to have a plan for, if one of your employees comes in and they have coronavirus and they have been exposed to other employees, what do you do if some of those exposures have been fully vaccinated versus if some of your exposures have not been vaccinated at all? So have a plan for that so it's easier to make those decisions when those situations do arise. And along the same lines of, we're not through this pandemic yet, we're also starting to see some longer term implications on what we need to be aware of as far as business operations go. In New York State, Governor Cuomo signed the New York HERO Act, which directs state agencies to create clear, enforceable health and safety standards that private employers have to follow to keep their employees and by extension, their communities safe. So this law directs the Department of Labor to issue airborne infectious disease standards for businesses that will include protocols on testing, face mask usage, personal protective equipment, social distancing, and other measures that would be applicable in the case of an airborne infectious disease outbreak. So these are directives that companies will need to be prepared to follow in the case of future issues. So this is important for companies to be aware of as we move forward, and I'm sure we'll see more guidance as we receive it from the state. That being said, it's important to keep practicing social distancing, continue wearing those face coverings, and regularly wash your hands with soap and water or use an appropriate sanitizer. Thank you and have a great week.